So I think if I can start by saying that the Families 2020 strategy is our real commitment to try and improve the life chances and the outcomes for children, young people and their families. And one of the key things for me is how do we actually work with children, young people and their families to help in terms of earlier intervention and prevention so they don't feel they have to be accessing statutory services. On the flip side, we don't feel we have to intervene much later. I think particularly for health, where we're seeing a huge rise in demand, that's really important. And that's why in part we are absolutely committed to this Family 2020 strategy. We're absolutely seeing that some of the things that we want to do, like reducing childhood obesity and improving children and young people's mental health, cannot be done if we're not working with the rest of the partnership to improve such things as education. And that's why we've given a really clear commitment through our own health 5-year sustainability and transformation plan that we will implement the Families 2020 strategy in full. So I really hope that we actually properly embrace some of the principles that we've outlined in the Families 2020 strategy to change the life chances for our children and young people and their families. Two that stick out for me. The first is that we actually need to do what we say we will do and truly start to integrate health and care services, both on the front line in the way that we commission or buy services. And the second is that we actually use technology in a different way. There's absolutely an opportunity in Suffolk, which I think we're behind the curve on, to actually look at kind of technological solutions, particularly with our young people who are so tech savvy in terms of how they access and get support for their needs, particularly health. And we really, if there's one thing I want us to do, is actually really improve the boundaries between services, that we actually integrate them in a better way. I think one of the early wins that we're already seeing is our approach as a partnership to children's emotional health and wellbeing services. So that's really looking at children's and young people's mental health needs. We've really started to tackle this as a local partnership, not just statutory services, so traditionally clinical commissioning groups and the county council, but how we engage with children, young people and their families, voluntary sector and schools to really co-produce what it is we want to do. Two of the early wins we've already seen is one is the development of a community eating disorder service, which is really starting to tackle some of the ingrained issues we've seen within Suffolk affecting young people. And the second is the development of a pathway and a service for young people affected with attention deficit hyperactivity disorder or ADHD. Just those two elements are going to improve massively the life chances for our young people. One is, it's all well and good us sat in rooms, in meetings, saying how great we're doing, but actually we really need to go out and speak to our young people and their families to actually see what change we've made within the years of this strategy. I really want to see a commitment as a partnership to actually continuing to co-produce the strategy with families and actually also involving them in some of the solutions. So as one of the other answers I gave, I was really clear that we need to be having much more focus on earlier intervention. That has to be done with the family, not to them. And I think the second one for me is that we've set ourselves some very bold ambitions within this strategy, and we are going to have to be really challenging to ourselves and as a partnership that we can actually meet the ambitions that we've set. We're really going to have to challenge ourselves to work as a collective of leaders as opposed to individual organisational leaders, and that, as we've found already, is a big challenge, particularly when you're not necessarily agreeing all the time. But I think through those two things, if we do them right, we will really see the outcomes we've committed to.